Today's medical-centric topic is broken tooth blues, what to do for pain and treatment options. A broken tooth can be a painful and uncomfortable experience. Not only can it be physically uncomfortable, but it can also cause anxiety and stress about how to handle the situation. In this video, we'll take a closer look at what to do for pain and a broken tooth, including immediate actions you can take and treatment options available. Immediate actions. If you break a tooth, it's important to take immediate action to address the pain and prevent further damage. Here are some things you can do right away. 1. Rinse your mouth with warm water to help clean the area. 2. Apply a cold compress to the outside of your cheek to help reduce swelling. 3. Take an over-the-counter pain reliever such as ibuprofen to help manage the pain. 4. Avoid chewing or putting pressure on the broken tooth. 5. Cover any sharp edges with dental wax or sugarless gum to prevent irritation to your tongue or cheeks. Treatment options. There are several treatment options available for a broken tooth, depending on the severity of the damage. Here are some of the most common options. 1. Dental bonding. If the damage is minor, dental bonding can be used to repair the tooth. This involves applying a tooth-colored resin to the damaged area and then shaping and polishing it to match the surrounding teeth. 2. Crown. If the damage is more severe, a dental crown may be necessary. A crown is a tooth-shaped cap that fits over the damaged tooth, protecting it and restoring its shape and function. 3. Root canal. If the damage extends into the pulp of the tooth, a root canal may be necessary. This involves removing the damaged pulp and replacing it with a filling material. 4. Extraction. In some cases, the damage may be too severe to repair, and the tooth will need to be extracted. This is typically a last resort option. Prevention. Prevention is the best way to avoid a broken tooth. Here are some tips to help prevent dental emergencies. 1. Wear a mouth guard when playing sports or engaging in other high-impact activities. 2. Avoid using your teeth to open packages or bottles. 3. Practice good oral hygiene, including brushing twice a day and flossing daily. 4. See your dentist regularly for checkups and cleanings. A broken tooth can be a painful and stressful experience, but there are several treatment options available to help address the issue. If you experience a broken tooth, take immediate action to address the pain and prevent further damage. And remember, prevention is key to avoiding dental emergencies in the future.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.